I think that real-world evidence studies are extremely important nowadays because there is still significant difference between the pivotal clinical trials and what's really done in a clinical routine. Non-usually exactly the same patients are entering on a clinical routine basis being treated with this drug. So it's very important to confirm the efficacy of these studies on an individual patient basis. I think the key is to clearly take long enough follow-up, probably of about 4 to 5 years, not just from when the treatment started, but also at least 2 years previous to treatment, and then to follow patients at least over 2 to 3 years longitudinally. I think another key is to really have a very strict inclusion and exclusion criteria to apply similar characteristics of what the pivotal studies have in order to prove whether drugs works or not in a clinical routine. You know, historically, measurement of lesions is useful on a clinical basis because a clinician by itself can determine whether the patient has or has not activity of the disease. Unfortunately, with more and more effective drugs coming, less and less patients, or maybe fortunately, have no evidence of new lesion activity. Nevertheless, that does not mean that disease is completely under control, because there is a neurodegenerative part of the disease that's still silently progressing. So more modern measures like brain atrophy, loss of brain volume have been proposed in order to measure truly the neurodegenerative part of the patient disease progression. So not long ago, the MS was considered a white matter disease, and now is considered a gray matter disease. So it's quite an important change. And it's because in the cortical gray matter and in the deep gray matter, so-called sapile lesions have been found. These are lesions which have demyelination but also axonal loss, and they are the driver of disability and cognitive progression. Now the challenge is that we are still not capable to detect them on any meaningful clinical MRI sequence, and that's why even on this Congress there are a lot of strategies that are being pursued how to measure or to evidence gray matter in real time, gray matter disease activity in real time.